JBS International Incorporated, under contract with the Substance Abuse and Mental Health Service Administration, or SAMHSA's Center for Substance Abuse Treatment, or CSAT, has prepared this instructional video series demonstrating core SBIRT skills in action.
Could you talk a bit about what are the essential points that you were looking to make in the video itself?
That's great. So the first thing that I think we always think about is welcoming the patient in any scenario where there's an interaction between a healthcare provider and a patient. And so what I did is, try to really focus my attention and be as welcoming as I could. I explained my role. Mm-hmm. And then I tried to build some rapport, not just around the topic of why the person came in immediately, but of course I said, that was a concern for them, but just who they were, just to try to make some connection and have an understanding of what their life is like. And then in terms of the one where I was demonstrating the use of the two tools that will be commonly used in a lot of these settings, the audit and the DAST, I first wanted to explain what the tools were about. For the audit, in the sense, the drink equivalencies, right? And making sure that somebody understood that perceptions that people have around the amounts they're drinking are different. And so we need to understand what the set amount is in the tool. And then also tried to very carefully go over the questions. And I asked in a way, probably it was part of the instructions, that it would be helpful if they could be honest and accurate. And that would give us the best understanding of the risks. So I made that point clear. And then I tried to slowly go through the questions, and even though there might have been some indecision on the point of the patient, I didn't want to make the answer. Often patients will turn to you when they're not certain how to answer, and they sort of try to draw out an answer from the administrator, the tool administrator. I wanted to be clear that I turn that back on the patient and let them decide. So those were sort of the essential points of that tool, without really pushing back, trying to do that in a way to build a collaboration, even around the screening.
Gotcha.
For these video demonstrations, filming took place in an office setting. In real practice, motivational interviewing and the SBIRT intervention is successfully delivered in exam rooms, bedside, or wherever the opportunity presents.
Well, Mike, I'm really glad you're here. I'm Dr. Turner. Hi, I'm the health psychologist, and I'll be working with you for the next half hour or so. It'll be brief, 20 to 30 minutes. And before we start, I'd just like to find out a little bit about you, so I get to know you. Sure. Can you tell me what happened that brought you in today, just real quick?
Well, I'm a faculty member over at community college. I teach sociology. Been there about 15 years, I guess. So that's where I work, yeah.
Yeah. All right, great. And who do you live with?
Well, I've got a woman, a partner. We've been together for about a decade, a little over 10 years now.
And how are things going with her and with your work?
Well, I guess, as good as any relationship is after 10 years. I mean, we have our good days and we have our not so good days, I guess. But no, in general, I think we get along pretty well. I like teaching.
So what do you do with your free time when you're not working at the school and also at home?
We like going to restaurants. I like traveling in the summertime. I get to the gym once or twice a week. I should probably go more than that, but truthfully, I don't. Movies, going out with friends sometimes, just kind of like regular stuff.
Great. So, today what I think of, what I want to do is I want to screen you a little further for the substance risk. And you mentioned that you might not have fallen if you hadn't had three glasses of wine and maybe smoked a little weed.
Yeah.
So let's look at that. And I know that with folks who drink and smoke sort of regularly, it can really affect your health. And that's why your doctor wanted you to come in. And so when you answer these questions, the most important thing to do is be honest and accurate. And so to do that, I just want to make sure when you answer these questions about alcohol, and that's the first set of questions we'll ask you. There's 10 questions about alcohol, and the tool's called the audit. They're talking about how much one drink is. And many of us have different ideas about that. And so it's important that we all get on the same page. And so this picture portrays the glass of wine is 5 ounces is actually the same as about a 1.5 ounce glass of whiskey or spirits and a 12-ounce glass of beer.
Okay.
Does that make sense?
Yes. Yep. Makes
Okay.
sense.
But when you answer, I want you to think back to whether this answer is never true for you. Okay. It's true in the last month. How many times per month maybe you do these things? So the first question is, how often do you have a drink containing alcohol?
Pretty much every night.
Every night. Okay. And how many drinks containing alcohol do you have on a typical day when you're drinking? And like last night before you got injured, you had 3.
I would guess, like 3, maybe 4, something like that.
Okay. And how often do you have 6 or more drinks on one occasion?
Used to be about once a week, but probably more like a couple times a month.
A couple times a month. Okay, so you can do monthly or weekly. Sounds like that's the range you're talking about.
Yeah. I'm probably closer to monthly because
Monthly?
I'm just not as tough as I used to be.
Yeah. How often during the last year have you found that you're not able to stop drinking once you started?
I've never had that happen.
Okay.
I can always stop.
You can stop.
Yeah.
How often during the last year have you failed to do what was normally expected of you because of drinking?
I think I pretty much always get my stuff done. I think my partner would probably like me to be a little bit more active sometimes. Like if I've had a couple of drinks, I don't necessarily want to go out or something like that. But
Right.
I pretty much get it done.
So it's never impacted your job performance at the community college.
Right.
Would you say that's true?
Yeah.
Okay. How often during the last year have you needed a first drink in the morning to get yourself going after a heavy drinking session the night before?
God, I would never
Okay. So that even repulses you to think about. How often during the last year have you had a feeling of guilt or remorse after drinking?
It's tough. I mean, I don't know about guilt. I felt really stupid this morning when I got up and I had like this thing on my head. Like
Sure.
I was probably more embarrassed than anything. But no, not guilt.
I don't want to try to guess, and I think you'll be good at just answering. So it's either never, less than monthly, weekly, or almost daily. So how often during the last year have you had a feeling of guilt or remorse after drinking?
No, I would say never.
Never. Okay, great. How often during the last year have you been unable to remember what happened the night before because of your drinking?
Well, I assume, and I guess the doctor's assuming that my drinking and having smoked some weed is why I passed out. He said it could have been like blood pressure or something like that.
Yeah.
So once, I guess what happened last night kind of covers it.
Again, it wouldn't be never, less than monthly?
Less than monthly.
Less than monthly?
That's the only time that's ever happened.
Have you or someone else been injured because of your drinking? So this,
Yeah,
Yeah.
I guess.
but not in the last year, yes, in the last year.
Yeah.
Okay. And then has a relative, friend, or doctor or other healthcare worker been concerned about your drinking and suggested that you cut down
Well, she has, yeah, my girlfriend.
in the last year?
Well, this morning.
Okay. I'm going to go ahead. Let's score this just so you see what the score is on it, because we can do that immediately. Okay. And I'll count that up quickly. And then we'll talk about the results. I also want to do the one, because you mentioned that you smoke weed every day. Also want to do the 10 questions around drugs. And then, we'll sort of talk about the results together.
Okay.
How's that sound? Okay. Let you know. So, in terms of a score, the alcohol tool gives you a 12. It's pretty quick to add up. Okay. And that really puts you at what we would consider like a moderate risk for using alcohol in a way that could be harmful to your health.
Okay.
Okay, and we'll discuss it more, but let's go to the drug screening questions, and then we'll come back and discuss some of the particulars of this.
Okay.
Okay? Using drugs, can affect your health, and I'm sure you're aware of that, although a lot of people think that marijuana isn't that harmful. It turns out to have some pretty harmful effects on the body and your mind.
Okay.
Which recreational drugs have you used in the past year? Have you ever used methamphetamines? No. In the past year, cannabis?
Yes.
Weed? You have.
Yeah, they call it cannabis. Excuse.
Inhalants?
No.
Tranquilizers?
No.
Cocaine?
No.
Narcotics?
No.
You're shaking your head like
No,
there's
none
no
of
way.
None of those things.
Hallucinogens?
No, I haven't done any. The only
Any
thing
other-
I've ever done is pop.
Some of them are pretty obvious, and so you can just, but I'm going to get you to answer them still. Have you used drugs other than those required for medical reasons?
Well, the weed.
The weed.
Yeah.
So that would be a yes. And these will just be yes, no answers this time. There's not a, do you abuse more than one drug at a time?
But just weed.
Just weed?
Yeah.
Are you unable to stop using drugs when you want to stop?
No, I can always stop.
You can stop. Have you ever had blackouts or flashbacks as a result of your drug use?
Well, I don't know exactly what happened last night. He was saying I passed out. So I always thought from like television, a blackout was like where you drank too much and you just like showed up like 200 miles away or
Right.
something. Yeah.
So you see it as maybe like more significant as really you're drinking and then all of a sudden you're gone.
Yeah, you're gone for like 2 days.
And that's not what you're pretty clear
No,
this.
no, I passed out in the
All
bathroom.
right, so I'm going to read it to you again and I'll let you answer. Have you ever had a blackout or flashback as a result of your drug use?
No, I don't think so.
Does your spouse or parents, partner ever complain about your involvement with drugs?
Yeah, my girlfriend has a few times.
Okay. Have you neglected your family because of your use of?
Not neglected. That sounds like harsh, but
Yeah.
I probably could be a bit more active sometimes. I can get kind of lazy.
All right, so let me read it again and you pick. Have you neglected your family because of your use of drugs? No or yes?
No.
No, okay. Have you engaged in illegal activities in order to obtain drugs?
Well, I mean, up until recently, I guess buying marijuana was illegal. It's sort of like a traffic ticket now, but so I don't know what they call that. But yeah, I guess. I mean, if you want to talk about that way, yeah.
Yeah. Have you ever experienced withdrawal symptoms, felt sick when you stopped taking drugs?
No.
No, okay. And have you ever had medical problems as a result of your drug use? Memory loss, hepatitis, convulsions, or bleeding?
None of those things. No. The passing out last night, I guess it would be a yes, but that kind of stuff, no.
Okay. All right. So if it's okay with you, I'm going to score this quickly, and then I'm going to show you a couple of charts so that you can see sort of what the scores mean. Okay?
Could you just sort of concisely summarize the essentials of screening?
Being very clear, being welcoming, building some kind of rapport and collaboration, asking patients how the information affects them, first, if you can, what concerns they have, fully understanding in a non-judgmental way why these patients are taking these risks for themselves, what they enjoy about using these substances, and then trying to understand what would have to happen for them to really want to make a change in these habits or this way of enjoying their life or relaxing or being social in these cases. And then doing some kind of a readiness ruler, we would call it, right? Once you've done the pros and cons and asked those questions for understanding, where are they in wanting to change now? And setting up some action steps to see if they're ready to get there and let them, develop those action steps for themselves.
Gotcha.
And just supporting them.
Great.